Hello, my name is Gabby Jordan. I'm a student at the University of St. Augustine for occupational therapy. My PICO statement for my critically appraised topic paper is, would the use of occupational-based activities increase the behavioral control within inmates in a correctional facility and lead to reduced recidivism rates in participants of such activities than that of other inmates with no occupational outlet? The summary of my search was the use of occupational-based activities to decrease behaviors and to decrease recidivism rates among prisoners. These three articles show that occupational therapists could be utilized within correctional facilities to improve offenders' psychosocial behaviors and decrease recidivism among ex-felons. The interventions of the three articles were a yoga program, a cognitive training program, and a human-animal interaction program. Each article showed a significant change in one area of behavioral control, and all the articles showed that occupational engagement and cognitive training yields positive changes. Future research needs to focus on the use of occupational therapists working within this setting to further support the findings of these three articles for our specific profession. The research needs to be a level 3 or higher. While I was doing the research for this topic, I saw that the quality of the research was relatively poor. Most of the studies have small sample sizes and are inconsistent in their measurements and interventions. Research needs to be done with consistent measurement tools and intervention approaches to portray an accurate picture of the legitimacy of this intervention approach. I believe this is an important topic for occupational therapy practitioners because it is underutilized as an area of practice, and I believe that it is important for our society because the need is very high for our psychosocial background and unique skill set. Individuals who have lived dependently in a correctional facility for a large amount of time need psychosocial intervention to cope with the stress of community reintegration. And if they do not receive this, then they fall back into old behavioral patterns because they do not know any other way to cope. Occupational therapists have the background to help these individuals reintegrate into their community successfully and remain independent without criminal behavior. It is important that more research is done to support occupational therapy within correctional facilities so these individuals can receive the help that they so desperately need. I hope that this research has piqued an interest within you and that you support or even do your own research within this topic. Thank you for listening, and once again, this is Gabby Jordan at the University of St. Augustine for occupational therapy. Thank you.